We're, I think, on the third Saturday of this month. It's the 20th Rosa for many people. And we're heading into the final 10 days. Can't really believe that it's gone so quick. Alhamdulillah. My name's Ibrahim, and today I've got on the line Sister Razia Bhatti, who will be representing a thalassemia hospital in Pakistan, and they treat a lot of the poor people and in Pakistan, and she'll be telling us all about the treatments that they do and how it benefits the people, and we're seeking your support, and they would like to raise awareness about their particular organization. So, Sister Razia, Assalamu alaikum.
Wa alaikum assalam wa rahmatullahi wa barakatuhu, Brother Ibrahim.
How are you doing, Sister? You all right?
Alhamdulillah, alhamdulillah. Thank you so much for having us.
Okay. No worries. It's good to let listeners know about these kind of important things. So, Sister Razia, what is thalassemia? I know you're not a medical professional, but in layman's terms, what is thalassemia?
All right. Brother Ibrahim, we have Dr. Adil from our hospital, Amina Bashir Memorial Trust. He's here as well. And he will put more of a light, enlighten you with from the medical background. But thalassemia is a blood disorder. Okay, it's a blood disorder. It's a genetic blood disorder, which means the person who has it cannot produce enough blood. This is just in simple terms. I'm not from a medical background. So it's a blood disorder that affects the daily life of the person who has thalassemia. And then for that patient, he requires a monthly top-up, in just simple terms, a top-up of blood. And then on top of that, he requires medication to get rid of the build-up of iron toxins. So that's the process, and that's a lifelong requirement for the patient.
And if a person who's affected with thalassemia, if they do not have treatment, what happens?
Lethargicness, they cannot function properly, pale skin, it varies in person to person, but it just they cannot function. Slowly the build-up of toxin affects other parts of the organs within the body, and over time their lifespan is reduced. So it's a life-threatening in general.
Okay, so it is quite an important treatment, it sounds like. Okay, so you're representing an organization today, ABMT. What is ABMT?
ABMT stands for Amina Bashir Memorial Trust. Amina was my mother, Bashir was my father's name, and this is in as a trust on behalf of, as a Sadqa Jariyah for my parents. And it's a hospital diagnostic center that we've established in Old Misri Shah, Lahore, in Pakistan. And it's a very poor area of Lahore, and we treat patients with thalassemia in that area, and anybody who requires it from within the facility or outside is open, and it's a free treatment we provide.
Okay, and do you serve just the people of Lahore, the people with thalassemia in Lahore, or does it treat patients from further afield? So, for example, somebody from the UK?
Well, if they need to come, if they need treatment, we can. It's a matter of arrangement of blood. They require blood to be transfused, so we can treat patients from overseas, but it's mainly for the registered patients, but that can be arranged.
Okay, I understand that you have a personal link to this particular hospital. That I understand it was your childhood home.
That's right. Amina Bashir Memorial Trust was established where I was actually born. It was our childhood home. We grew up there, and then in the 70s we came to London. And after my parents died, we had the house converted into a hospital, and it's a registered hospital with all the respective functioning required.
Mm-hmm. And what makes ABMT different from other thalassemia hospitals?
We are very small scale. Okay, we at the moment only cater for 100 patients registered. Okay, and the thing is, it's a lifelong treatment that is provided to the patients, and because of our small scale, we are very we have a very family environment. It's not a clinical setup where, our patients, they actually look forward to coming to our hospital for treatment. This is from research, this is from interviews from the parents, and they actually look forward to coming to have their blood transfusion, because it's a day out. We provide a holistic treatment. We provide a holistic environment for the patient as well. So it's not just come into a hospital, have your treatment and go home. They're there for the whole day. When they come from, sometimes some of the patients come from 3-4 hours travel distance, but they come to our clinic, and then we provide them the meals, we provide them entertainment, because they come not just with their siblings who need the treatment, the whole family come. And the other siblings, we have a play area, we have entertainment area that they can go there while the patient is getting treatment. So we provide a holistic family environment, and the patients love it. They just, the parents say they so look forward to coming, and we provide them this. Dr. Adil is also on there. Brother Harun is there. If they like to add anything.
Brother Harun, are you with us? Okay, I think, we've been having a few difficulties with Brother Harun. Are you with us?
He's muted.
He's muted. Okay, yep. So once you unmute yourself.
Wa
alaikum salam. How are you, Brother Harun?
This is Brother Dr. Adil speaking.
Sorry, this is Dr. Adil. Okay, sorry.
From Pakistan.
Dr. Adil, how are you?
Fine. How are you, everybody? I hope all is well.
Alhamdulillah, everything's good. Jazakallah khair for joining us from Lahore and giving up your valuable time. Are you in clinic today? Are you treating patients today?
Yes, I will be seeing patients today. Today, unfortunately, I'm not treating today is one of the days where we have this problem.
Sorry, Brother Adil, sorry. I'm finding it quite difficult to hear you. I'm not sure if there's something covering the mic, or if you could try again. I don't know if what device you're on, but if you could try and maybe move a bit closer or something.
Can you hear me better now?
That's better, yeah.
Wonderful. So what I was saying is today I'm actually very fortunate to be here at Amina Bashir Memorial Trust. Today we've arranged iftar for our children as well as their families. And so what we try to do is really provide them the medical care that they need, as well as patient support groups where they get an opportunity to actually meet other children with thalassemia and actually learn from each other on how to actually deal with thalassemia. And keeping in mind, that any chronic disease comes with a significant social and emotional burden. And normally that isn't being addressed by thalassemia centers in Pakistan. But I am proud to say that here at Amina Bashir Memorial Trust, we actually do look after their social, emotional needs as well. And how we really try to do it is bring all these patients together and have them actually interact with each other, learn from each other, understand how they deal with arranging their children going to school. Our main aim is to ensure that these children become productive members of the society, and they are actually able to take care of themselves. Some of our thalassemic patients are actually now employees at Amina Bashir Memorial Trust. So previously, they're continuously getting treatment here, but also at the same time, they're employed so they can actually live a very positive life.
MashaAllah, very good. And Sister Amina was mentioning that, and like as you've mentioned as well, you provide a holistic treatment where the whole family comes on the day of the treatment of the particular patient. And so it sounds you get the whole family involved, and you pay for their transport as well. Is that correct?
So most of our children do come from nearby, although some of the children come as far as Sialkot and other places like Sargodha. So those are distances of more than about 100 kilometers. So when they come, we do support their transport.
Okay, that sounds excellent. Dr. Adil, can you tell me a little bit more about, or tell our listeners more about thalassemia? What is it?
Yeah, so I was listening in when Sister Razia was actually talking about thalassemia. So it was pretty accurate in that regards. Just to make it very simple.
Promote Sister Razia live on air to doctor status, or it requires a little bit more?
I'm sorry, could you repeat that?
Apologies, that's my joke for the day. And I was just saying that Sister Razia seems to have done a good job on explaining what thalassemia is, but
Yes. I'd just like to add here that if the children don't get the treatment they need and they don't get the blood which they actually require, many times they don't survive. And that's the importance of having such centers established, and actually having centers which actually do look after the child in a holistic manner. There's a number of thalassemia centers across Pakistan. The way I feel that we have actually, we're different from the others is the fact that any child who is registered with us, we're committed to supporting them with their medication, with their blood transfusions, with other needs which they may require throughout their life. And that's why we are limited at the moment with the number of children which we can have registered with us.
Yes.
And we're looking forward to the generous support of your listeners as well as the community at large to actually support more children in coming in and getting registered with us.
Okay, how many children do you currently support? How many patients do you have?
So we have about 150 patients at the moment with us who come and visit on a regular basis. And we have a waiting list of about 400 children who are waiting to get supported. What we ensure that we don't half-heartedly support anyone. If they're registered with us, they're going to be we're going to be taking care of them lifelong. And that's where the commitment comes around, and that's where we're actually looking forward to regular the donations and really support for these patients.
Okay, so you mentioned children, but it seems, and you're saying it's lifelong, so presumably you still continue to support the children once they become adults?
Yes, well, I call them children because I'm a pediatrician and a thalassemia specialist at the moment, but still 35-year-old, what I call them children, come to me for their thalassemia care because a lot of the adult medicine folks do not actually know really about how to handle these thalassemia children. In addition to that, we're fortunate enough that a lot of our children who grew up with us, I've been associated with Amina Bashir Memorial Trust for the last 12 plus years. And these children who have grown up with us are now married, now have kids of their own, and they're healthy, they're active, and they're living a normal life just like any one of us.
Mashallah, that's okay. So it seems that you're giving them, or you're enabling the children to have a normal life into adulthood. If you could tell me the difference. So Sister Razia mentioned it without treatment, thalassemia can end a person's life prematurely, let's say. What is the life expectancy for a person who has received treatment and who does not receive treatment? What is the difference?
So in Pakistan, for a child who has not received proper treatment, their life expectancy is 12 to 15 years. And for children who actually receive proper treatment and transfusions, it's as long as you and I would actually live.
Okay, so you can basically, give a person a normal life. And you've mentioned that they have families of their own, so they lead a productive, normal life with the treatment or the intervention that you are putting in at this thalassemia.
Yeah, absolutely, Brother Ibrahim. Just to let you know, some of our kids are now professionals. Some of our kids are doing their own jobs. Some of them have their own businesses. Or whether it's a small shop which they run along with their dad, they live just like normal children and normal adults for that matter. And that's what our aim here at Amina Bashir Memorial Trust is. You'll hardly ever see any one of our children not smiling. That's the wonderful part of it.
Alhamdulillah. Have any of the patients grown up to become thalassemia doctors?
Well, not at Amina Bashir Memorial Trust, but other children which I do follow in my regular hospital job. Yes, we have 2 thalassemic children who are actually now just in medical school.
MashaAllah, very good. What are the rates of thalassemia amongst the Pakistani population?
So an estimate is that we have about 5,000 to 7,000 new thalassemic children born every year. So you can imagine that over the years, there's a significant disease burden which we tend to face.
Okay, what is that as a percentage, and compared to other chronic diseases, is it quite high?
Well, not necessarily, which is a good thing. So other chronic diseases, if you think about diabetes, if you think about hypertension, that's much higher. Thalassemia is much less than that. But the problem with thalassemia is these children may require 1 to 2 or sometimes 3 blood transfusions every month, and plus expensive medication to actually remove those iron toxic compounds from their body, which normally our body doesn't remove.
Okay, and is thalassemia something that's more prevalent amongst South Asians, so amongst Indian? So a lot of our listeners here in Leicester will be from an Indian heritage. Is this something much more common amongst? Are we, like, for example, diabetes is something more common amongst Indians and Pakistanis? Is thalassemia similar?
Yes, absolutely. So, and the reason is a lot of our South Asian countries or our South Asian people do intermarriages. And because of interfamily marriages, a lot of genetic disorders, just like thalassemia, become more prevalent. So you're absolutely right in saying that the South Asian populations may have a higher frequency of thalassemia compared to others.
Wow. Okay.
If I can add to that, we have a prevention. Our aim is to educate the awareness of thalassemia. So we have a prevention program in process where we go to universities as well, just giving talks on awareness. Okay, and all it is you can be a carrier of a thalassemia gene and not know and live a normal life. There's 2 traits, a major and a minor. So if you have a major and your spouse or your future spouse has a major trait within your gene, then you have a 25 chance. Sorry, I beg your pardon. You have a 25% chance of your offspring having a major trait, therefore requiring a lifelong blood treatment.
Okay,
so education is paramount. So we have we are linked with Ganga Ram Hospital, their prevention program team, and they come and screen the patients, their families. So that's one of the ways that we are trying to tackle prevention of thalassemia occurring, and that just requires a blood before they get married to establish whether they are carriers. And then if so, you know, whether their future spouse, what should they be, if they're carriers, what are the chances? We bring about awareness. So that's how we are trying to tackle it as well, inshallah.
So presumably you educate the population and then leave it up to them, informing them of the risks that they...
We try to...
I think if I could just add here, we go one step further than just educating them. We actually provide them the blood test, which is free of cost. So if they or their family members or their extended family members, with the help of the prevention program in Punjab, we offer them free screening for their family members, for other members as well, or anyone for that matter who is concerned about whether they are a thalassemia carrier or not.
Mm-hmm. Okay. So Dr. Adil, you sound like you're the medical director at this hospital, it seems. And who else is part of the team? Sister Razia, you're based in the UK and you help fund the hospital here?
We as a family, friends, our community here, they're very supportive, and that's how we have been funding it. And we're all volunteers here, down to Dr. Adil. We are blessed to have his service. He's alhamdulillah, it's all volunteers involved in this, and you know, this is such a blessing. And alhamdulillah, this is how we are going. We get no funding from government. We're supported by friends, family, and the community. And awareness of Amina Bashir Memorial Trust is, you know, paramount.
Okay, excellent. So Amina, so listeners who have just joined us, you're listening to Ramadan Radio London on Ramadan Radio Leicester on 87.7 FM and online at ramadan.fm. I'm joined today by Sister Razia and Dr. Adil of the Amina Bashir Memorial Trust, which is a clinical lab, a blood bank, and a diagnostic center for thalassemia patients, based in Lahore, Maharishtra area. Mistrisha area even. And we're talking about how they are run and how it helps the community there. What are your annual running costs?
So just to give you an example, Brother Ibrahim, our running costs involve providing properly screened blood for patients, as well as the expensive medication. So on average, on a monthly basis, approximately £100 per child is actually spent on their care, their diagnostics, their medication, and their screened blood, which they actually require, as well as blood transfusions.
Mm-hmm. Okay, and this is all free to the user, it seems, and that's why you require people to support this project. Is that right?
Yes, absolutely. This is provided totally free of cost, without any charge to patients. But obviously there is a charge for any service, and that's where the community, the family, our supporters actually play a humongous role in actually supporting the treatment of these children.
Okay, excellent. And listeners, if you do have any questions for the Amina Bashir Memorial Trust, please do text in your questions or WhatsApp them to 077 488 55 055. That's 077 488 55 055. Or you can even call in on 0116 48 22 086. That's 0116 48 22 086. Excellent. Dr. Adil, how long have you been working at this hospital?
So I've been working here for on a voluntary basis for the last 12 odd years. And I hope to be associated with this thalassemia center lifelong. It's become a passion with me, and really, it's the great work which is done here, which just keeps me motivated to come all the time.
Okay, and Dr. Adil, where were you educated? Were you educated in? Where did you do your medical degree?
Yeah, I did my medical degree from the Aga Khan University in Karachi, and then after that, I'm a U.S. trained pediatrician. So I did my Diplomat American Board of Pediatrics, and after being in the U.S. for about 4 years, 4.5 years, I did come back to Pakistan, recognizing my roots. So that's where I was actually trained and educated in my medical school.
Okay, so it's excellent to hear that you're now feeding back to the community where you grew up and supporting
yes,
them.
Absolutely. It's just a heartwarming experience dealing with these children. I think everyone who actually participates, whether it's with their time, whether it's with their donations, whether it's, it means so much to these children, all the support that they can get from this center.
Okay, and would you say the level of equipment and the level of care that you provide is similar to what we would get, say, in the UK?
I can give you a simple example. Obviously, it may not necessarily be as good as the UK, and many of our private setups are also not as good as the UK. But if you look at Pakistan, I mean, the fact that we have children who are now parents and who now have children of their own is testament to the fact that these children are being treated properly and their disease is actually being taken care of in a very, very effective manner.
Okay, it sounds like to me that perhaps you're providing a better service than what you would get in the UK, because you're not only treating a patient, you're taking a holistic approach and involving the whole family, and you seem to have better outcomes.
And Brother Ibrahim, if I can add to that, while I was at the center last year, just a small story, and like Dr. Adil said, that some of our patients travel long distances, 100 kilometers to travel when you're from a poor background and financially you cannot, day to day, you're running your costs on a daily basis. And some of the patients come from like 100 kilometers, Sialkot. And I asked some of the parents up there, I said, you have other hospitals near you. Why do you not get your child treatment from there? And they said the screening process, that's the screening of the blood before it is given to the patient, is so high at Amina Bashir Memorial Trust that we, the fact of getting infection through transfusion, through the screening process, ours is so much better than even the local hospitals there. And that is the reason why they're willing to travel that far to come there. And on top of that, what we provide is a family sort of environment. It's not a clinical. So these sort of things outweigh other hospitals when we may be small, but we provide quality, alhamdulillah, and that goes for the satisfaction of the patient and the family.
Okay, excellent. And you're currently treating 150 patients, I understand. What are the plans for future? Are you planning to increase the size? Are you able to increase the size of the hospital or treat more patients?
Do you know what? We have the facility to provide the treatment. We have the resource. We don't have the resources. That is what's holding us back. We have 400 children that are on our waiting list, waiting for treatment. They're currently getting treatment from elsewhere, but they would rather have that treatment from Amina Bashir Memorial Trust. However, we cannot take them on because it's a lifelong treatment. And, we cannot just take them on and then disappoint them after a year when we don't have the resources, the funds to treat them. So because of that, we have to be very stringent on how many patients we can have. We have the facilities, but not the resources. And we have 400 children who are waiting to come on board to have their treatment at Amina Bashir Memorial Trust.
Okay, so you seem to have the facilities, but just not the resources.
Financial resources, absolutely.
Resources. All right, okay. And this is the Amina Bashir Memorial Trust we are speaking about. And if you do, listeners, if you have any questions, please do text them in on 077 488 55 055. That's 077 488 55055. We've got about 13 minutes left, inshallah, of this program. Is Dr. Adil still with us?
Yes, he is.
Yes, I am,
Okay.
Brother Ibrahim.
Okay. Can you tell me more about, have you treated anybody from India? I'm very good with geography.
Actually, not India, but we do treat some families who do come from the UK on holidays, or when they come back to Pakistan or they come to Lahore. We have families traveling, and obviously they have their treatment being done in the UK, but they need that support while they're here in Lahore, Pakistan. So we do look after them. In addition to that, other families from Saudi Arabia, when they travel and they have children with thalassemia, they do visit our center.
All right, okay. And is this hospital, it sounds that it operates like a charity. Are you a registered charity?
Yes, we're a registered charity both in the UK and in Pakistan. And in addition to that, like Sister Razia mentioned earlier, we're also registered with all of the healthcare commissions in Pakistan, as well as the transfusion authorities and the health authorities, which actually ensure that all of the care which is provided here is up to standard.
Excellent. And do you have a website that people can find out more about?
Yes, we do. Amina Bashir Memorial Trust, UK.org. So just use the initials ABMT UK.org. Your listeners can log on there. And we're on Facebook as well. So you can see all Dr. Adil in action there with his patients. Obviously, patients' consent has been taken before publication of any of their pictures or anything. So alhamdulillah, we are on board with all the regulations, alhamdulillah. But anybody listening, please do join. Please click abmtuk.org. abmtuk.org. Amina Bashir Memorial Trust, UK.org. So anybody, we would love your listeners to, in this blessed month, to take advantage and join us on this journey to serve humanity, inshallah.
Inshallah. So that's abmtuk.org. And I see from the Charity Commission website that you're also registered for gift aid as well, which sounds excellent. So you can, if anybody did want to support, they can increase their donation as well.
And Brother Ibrahim, one more thing I'd like to add, that we operate 100% policy. All donations will be 100% used towards the treatment of patients and towards the ABMT. It's not nothing else, no other expenditure was added. 100% donation in this, inshallah.
Sounds good. Okay, so I think we'll close the program. In summary, if you would just like to highlight what ABMT does. And
Dr. Adil?
Sure. So just in summary, Amina Bashir Memorial Trust Thalassemia Center is a center located in Old Misri Shah, Lahore. and it basically takes care of thalassemia patients. We have 150 patients which are currently undergoing comprehensive holistic care, and we have 400 children on our waiting list waiting for your support and your donations to actually get the treatment which they need. Thank you very much.
Okay, and Sister Razia?
Absolutely. Just on this blessed month, I can't reiterate the importance of let's make this, let's invest in our hereafter. Okay, the hereafter bank, and that is through your good actions, your donations, however you can support, blood donations, however you can get involved with any charity, do take benefit of this month, and inshallah, this is our investment for the hereafter, because we're here only temporarily. Our life is permanent in the hereafter, and let's build that home for ourselves in Jannah, inshallah. So ABMT UK.org is your first step, inshallah, and Allah subhanahu wa ta'ala put barakah and accept everybody's ibadahs and everybody's contributions towards Amina Bashir Memorial Trust. And we look forward to your listeners joining in, inshallah, and thank you so much for having us.
Okay, Jazakallah khair, Sister Razia Bhatti and Dr. Adil from Lahore, Pakistan, and informing our listeners about thalassemia and the treatment that you provide at the Amina Bashir Memorial Trust. If anybody would like to find out more about Amina Bashir Memorial Trust and support their work, please do visit abmtuk.org. That's abmtuk.org. Inshallah, I'll be back in about 20 odd minutes, 15 minutes or so, and I will be interviewing Sister Sophia Bhatti, and we will be speaking about death and the processes, the practical processes that need to take place when death occurs in the UK.